Hi, everyone. I'm Lauren Underwood, and I have the honor of representing Illinois' 14th Congressional District. As many of you know, Illinois recently entered Phase 1B of the COVID-19 vaccination effort, allowing Illinoisans aged 65 and older and frontline essential workers to sign up for vaccines. We know that right now there are not enough vaccines for everybody who wants one, and many of you have reached out to my office with questions about vaccination in our community. So today I've invited Rayanne Van Gundy, the Executive Director of the Kendall County Health Department, to help answer your questions about vaccination. Thanks so much to those of you who submitted questions in advance, and we'll get to those questions in just a moment. But first, I want to share an update with you on what we've been doing in Congress to help increase the availability of vaccines, of testing, of treatment, and financial relief in Northern Illinois. I supported bipartisan legislation that was signed into law in December that provided billions of dollars in urgently needed funds to accelerate the free and equitable distribution of safe vaccines to as many Americans as possible and as soon as possible. It also implemented a strong national testing and tracing strategy with billions of dollars to support our heroic healthcare workers and providers. We also secured a new round of direct payments worth up to $600 per adult and child. And we provided critical funding to help small businesses, including $284 billion for first and second forgivable Paycheck Protection Program loans, with targeted help for live venues and cultural institutions, and additional grant funding to help many smaller businesses on Main Street in the Illinois 14th. In addition to delivering more financial support to families and small businesses bearing the brunt of this crisis, my priority in this next relief package is ensuring our communities have the resources that they need to safely reopen, which includes massively increasing the availability of vaccines. This week, I was delighted to see the Biden administration answer my request to commit more FEMA support to the vaccination and COVID response effort. I also recently introduced the Community Immunity During COVID-19 Act to deliver urgently needed resources to local public health departments and their partners to meet the demand of COVID-19 vaccinations and other vaccinations children and seniors are missing out on during the pandemic. My Health Force Act will recruit, train, and employ thousands of new public health workers to carry out mass vaccinations, better communicate with the public, and prevent the next public health crisis. And I haven't wavered in my commitment to lowering the cost of healthcare. Now more than ever, we need to cut the cost of premiums and out-of-pocket expenses. I'm fighting to increase tax credits to lower the cost of care in the next relief bill. So now, I am really excited to welcome Rayanne Van Gundy, the Executive Director of the Kendall County Health Department. Rayanne, thank you so much for joining us. I'd love if you could kick off our conversation by providing a brief update on the vaccine distribution in Kendall County.
Wonderful. Well, thank you so much for the invite today. We're super excited here in Kendall County. We have been working very hard for the last month getting these vaccines out. We know the importance of getting them out immediately. As soon as they come into our department, we are working along with our team members and our community to get these into the arms. We're doing it with minimal health department staff, but an array of community members. So we're very excited about this process.
Good. And so the first question is one that we receive quite a bit. How can a senior or someone who doesn't use the internet or have an email address get assistance with scheduling an appointment?
Wonderful. Great question. We fully recognize that an electronic scheduling system is a barrier for our seniors. We understand that clearly. We need you to call the health department. We'll take their name and their best phone number to reach them, and we have people designated to get them registered. And when they show up at our site, we'll have a ticket printed, kind of like a will call window, and have them receive their ticket, and they can move through the process. There should not be any barriers to getting this vaccine, and we realize that this has the potential to be one, and we're really working with our seniors to provide access. Our phones are busy. Oh, I'm sorry.
No, go ahead.
Our phones are very busy, so it'll take some patience to get in, but we will receive your phone call, and we'll be calling you to schedule your appointment.
Yes, I think everybody's phones have been ringing off the hook, looking for vaccine or having questions. And I feel for you and your team, that's for sure. Thank you. What if someone's eligible for a vaccine, but it's temporarily homebound due to an injury or illness? Are in-home vaccinations taking place in special circumstances, or will they be in the future?
So for right now, we're still doing kind of the same thing with our seniors. So please call the health department. We'll take your name and the best phone number to reach you and get them registered. And when I say get them registered, we'll work with them on what their situation is, what their circumstance is, and best to understand their risk of exposure. And that's going to put them in line to receive the vaccine.
Okay. And so this question comes from Shanna in Oswego. Do you know when library workers are going to be eligible for vaccinations, and who exactly is included in the frontline essential workers who are currently eligible for the vaccine?
Right. We get this question very, very often, so I'm glad it came. Currently, we're vaccinating our first responders, adults age 65 and older, as well as our educators, which can include our daycare and our child care centers. The state of Illinois is still working with local health departments to further define essential frontline workers. And so on Monday, we're going to have a meeting they'll give us a little bit more of a granular view of who those essential frontline workers, including the librarians and as well as legal in there. So I don't have an answer right today. However, I know that the state has recognized this. It was on a call this morning with me asking about librarians. We understand the importance of getting them vaccinated, and we'll know more come Monday.
Well, thank you, Shanna, for that question. Now, does Kendall County have any mass vaccination sites? And if not, are there any plans to create one?
So really, Kendall County is taking a unique approach. It's kind of a two-prong approach. We have a mobile clinic site that we are open and activating almost 3 to 4 days a week. The city of Yorkville has donated what's going to be their new city hall. It's a vacant building. It's perfect for us to go in and have a mobile site. And so we do that daily with upwards of 550 vaccinations, 3 to 4 times a week. And then this weekend, we're holding our first mass vaccination. We are having what we're calling Senior Saturday on February 6th. And because of the Super Bowl on Sunday, we're calling it Super Educators. So those are really our closed pod groups that we're looking at to vaccinate. We're going to be vaccinating over 4,000 people over this weekend alone at Yorkville High School.
Amazing. Okay. I think that's going to be a great day, even with the snow.
It's going to be fabulous. And each day this event takes 140 volunteers, and 50 of those volunteers are nurses. So it's a huge undertaking, and we're so excited just to get these 4,000 vaccinated in 2 days.
Thank you, nurses.
Yeah.
Another question that we get a lot from people are, well, I guess people that are eligible, but then they're having a hard time scheduling these appointments because they can't find an open slot. Can you share how often appointments are added to your online portal, and what are the best times during the week to check for a new appointment?
Yeah, we get this a lot too. With vaccine being so limited at this time, we know that increases are coming. We're very thankful for that. So we post new events as soon as we find out our allocation from the state. So what we don't want to do is create events and then not have vaccine to fulfill those and cancel appointments. So it's important for us to find out the allocation first, and then we take a planning day on what work group we're going to be vaccinating for the week. And so generally Friday and Saturday, you'll see new events posted onto our website. Those portals, they are filling up fast. We understand that you're going to be looking for a green appointment time. If it's red, it's already booked. If it's green, you need to get on and register immediately. I think you have 30 minutes to complete your full registration. But really look on Friday and Saturday, and that's really when we're going to be posting our new events once we find out what our allocation is for the next week.
Okay. So this question comes from Ellen from Oswego. What's your best estimate of when vaccination appointments are going to be available to every Kendall resident eligible in phase 1B?
Yeah, great question again. And my best forecast is going to be probably closer to the end of February. We have over 13,000 elderly in Kendall County. That's not super conservative. I hope it will be sooner, but to play it safe, I'd like to say the end of February. And again, it all depends on the supply of our vaccine and how much we have.
Right. And then Cynthia from Plano wants to know why families aren't being vaccinated together. She has a family of 5, including grandchildren with severe asthma, and would like them to all receive the vaccine together.
Oh, Cynthia, I greatly appreciate this question. I understand why this would make sense. However, the health department is following all of CDC, ACIP's, and IDPH's guidelines for the rollout of the vaccine so that we're consistent throughout the state. And really, we're trying to ensure those that are at most risk for exposure are vaccinated first, but we know the importance of getting everybody in the family, and we'll work our best just to make sure we're getting those vaccines in the arms as quickly as possible.
Okay, well, Rayanne, you've been so good to answer all of these questions for us. I have one more. What is the best way to stay updated on vaccination in Kendall County?
So we're getting better every day with our communication through our Facebook, as well as through our website and Twitter. So just make sure to check back to our website for those new pods that open up, as well as our Facebook and our Twitter sites. Those are the best way for us to get our information out as soon as possible, as well as our local media. We're informing them at the same time.
Well, thank you so much, Rayanne Van Gundy, for joining me and answering our community's most pressing questions. I appreciate your time and all that you've been doing, and all of your colleagues at the Kendall County Health Department for this amazing effort to keep our community safe and healthy. Thank you to everybody who's watching. And before we wrap up, I want to remind you that vaccines are safe and they work. And so controlling this virus will put us on the path towards economic recovery and building a better future. Please remember to continue to wear your mask, stay 6 feet apart, and take good care of yourselves, everybody. If you need to reach out to my office, you can do so by calling us at 630-549-2190, or you can visit us online at underwood.house.gov. Thank you.
Thank you.